Hi, I am Dr. Abhilash Francis, Specialist ENT, Badr Al Samaa Hospital. Today I would like to share something about pediatric snoring. So as we all know, snoring was considered to be a sign of deep sleep, and we think that we will have a refreshed sleep with snoring. But actually snoring can be sinister also. Sometimes snoring can be a sign of obstructive sleep apnea. That is, you will have an obstruction in the nose, or the throat, the mouth, which can cause decreased oxygen in your body, which can result in a snoring as well as restless sleep. So when should we consider the snoring to be sinister? If your child is actually having a restless sleep, mouth is open, has recurrent history of nose blockage or nasal discharge, or sometimes having bed wetting at night, we should think of problems in the nose or the oral cavity. So the common culprits in children are basically the tonsil, as you all know, present behind the tongue, as well as adenoids, which is similar to tonsil, present behind the nose. These are actually part of the lymphatic system in our body, where our immunity is developed until the age of 3. After 3 years, the other organs of the body take over. So during this initial part, these adenoids or tonsil can enlarge and cause some problems, especially snoring, difficulty in taking food, recurrent infections in the adenoid or tonsil causing loss of school days. Sometimes it can even cause problems in hearing, because adenoids can block the tubes to the ear, which results in the ear to get clogged and resulting problems of hearing. The common causes of adenoid enlargement or tonsil enlargement is either food allergies to dust, that's a pollution. We know that climate is global pollution is increasing day by day, and basically the foods like fat foods or junk foods also, and this can cause the increased risk of allergy, as well as some congenital problems like cleft palate or cleft lip, which can also cause increased incidence of chronic tonsillitis or adenoiditis. So the treatment that we usually suggest, first thing is avoidance of these risk factors like food allergy, avoidance of cold climate, cold drinks and all those things, and also we can treat them conservatively by giving some antibiotics for some short course, as well as intranasal sprays. These sprays actually reduce the inflammation in the adenoid and the tonsil and the adenoid, and this can reduce the size of the adenoids. So if it fails, what to do next? There is a role of surgery that we usually do for adenoid and tonsil. It's specifically removal of this enlarged tissue, the tonsils or the adenoids, either from the nose or from the mouth. Now the latest modality that we use is something called as coblation. Coblation means controlled ablation. That is, you use the heat generated to dissolve the tissue and remove the tissue. The advantage with the coblation technology is that it produces very less heat when compared to other modalities, very less pain, hence very less pain for the patient, and also it seals the tissues very easily, so that bleeding is very less. These tonsils and adenoids are actually very vascular structures, so the bleeding is one of the major complications that can occur. So with the coblation, we can have controlled removal of the tissues, and we can also have less pain during the surgery. After surgery, we can actually send the patient immediately, or within in the daycare surgery, we can send in the evening with the help of this coblation technology. So in coblation, we actually use the normal saline, that is, water is used to cut the tissue. The plasma is generated from the normal salt solution that we use, and this actually dissolves and removes chunks of tissue. There is no charring of tissue, and so chances of bleeding and chances of infection are very less with coblation. So in this method, we can actually use either through the nose or through the mouth to remove the tonsil as well as the adenoids. Separate specific instruments are used in both the conditions, and after the surgery, patient has to have a soft diet for at least 3 days. In children, they are very happy if you ask them to take ice cream after the surgery. So they can eat immediately after the surgery once the sedation is gone, and then they can go home on the same day without any pain or any other complications.